Hi to all my friends, to all my followers, to all the listeners, and to all the future listeners. So today we are going to talk to all the teenagers, to all the young people that suffer from acne and that are at wits and don't know what to do with their skin and how to treat their skin, and they are desperate. And so I just picked up an email that I got a few minutes ago from a 14-year-old teenager. I can't figure out by the name if it's a girl or a boy, but we will address it as generalities. And the email went as follows. The young person stated, I think it's a boy, but it might be a girl, that he is at the end of his wits. He's very depressed, or she, whatever it be. The reason for it is that that the person suffers from acne, and that the person said as following. They said that they used every possible cleanser on the market, and every cleanser dries their skin out, and it's not helping them with their pimples and their breakouts. And they bought moisturizers, and the moisturizers don't work, and they break out even more. And they said, is there anything that I can suggest, or is there any help? So boys and girls, yay! There is a lot of help. And I want to elaborate a little bit about this because I think that it's very important that you guys understand something. I said it in many videos before. I will repeat this. Acne is a condition. It usually happens in teenage years, although lately we see that more and more adults suffer from it. Here is the issue that acne causes, and when you guys use the inappropriate products, you end up with dry, blemished, inflamed, broken out, irritated skin, and you are at your wits. Now, why am I saying this? I will tell you why I say this. Not because I am trying to sell you a product, because I really don't care if you buy an acne line from me or not. That's not why I am talking to you. I am telling this to you because I am 36 years in this field, in this industry, and because I see so much wrong on the outside, on the market, and because we in the United States are in a society that everything is selling, 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 business, 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 money, money, money. And 90% of all the products and the companies that manufacture products for acne skin condition manufacture products that are either too harsh for the skin, or they don't work at all, or they do nothing. They are benign. And the problem is, I won't name by names, but I know that a lot of you out there know, because I get at least 15, 20 emails per day about people that complain about one particular product line that makes big claims and sells acne products on the internet and on TV for many, many years, and through infomercials. And the complaints are about this product line, for instance, that the products work at first for the first 2 weeks, and then they don't work. Why? Because they dry the skin out. Why do they dry the skin out? So we are talking about this company and many other companies. When you use a product for oily acne skin that's commercially made and commercially sold, if the product works, the product uses benzoyl peroxide. Benzoyl peroxide as such, as a product itself, is not a bad product. However, in order for you to see a difference, in order for you to see that your pimples are drying out, companies have to manufacture the product and put high quantities of benzoyl peroxide into their cleansers, their washes, into their toners. And people overdo them. But the reason they do it is because you have to see an improvement. Then you keep reordering on an automated system and you buy more products. That's for the company that I'm talking about. It's very big, that everybody thinks when they're teenagers, this is the product to go to because it dries the skin out, dries the pimples. However, the problem is this. There's too much benzoyl peroxide and the product dries your skin out. There has to be in life a balance in everything. So for instance, benzoyl peroxide, if it's used only on pimples for 3, 4, 5 nights to help to dry the pimples, get rid of the infection, is great. However, not all your skin needs to be washed with benzoyl peroxide every single day to dry it out, because not all of your skin is broken out, only certain parts. And when you use these harsh washes that claim that they get rid of acne, which they don't, they just dry the bacteria, but the acne is still there. These products dry your skin out. It doesn't matter which one you use if they have benzoyl peroxide in them. That is the wrong approach. So then what happens is you dry your skin out, the pimples shrink, so you think they are going away, it's working. However, if you would look closely in a magnifying mirror, you would see that the skin is totally congested, flaky, and dry. Well, what happens now, because you are breaking out, and usually teenagers have their hormones are playing a havoc on their body. There is no balance yet. There's a lot of sebum, a lot of oil produced in the body. So that oil is now trying to come to the surface. And guess what happens? When this is congested, it cannot go through, it cannot break through, because there is a layer of dry, flaky, congested skin. From what? From the products that you were using, the cleansers, the peroxides, that dry the skin out, that have peroxide in them, even if it doesn't say so, but that's what dries the skin out. So then the sebum, the oil cannot come out, so it creates, it's charge, then it stays under the skin, and it creates abscesses, it creates wounds, it creates acne breakouts under the skin that cannot come out. Well, then it gets inflamed, then it gets very painful, then it gets red. And then you say, what shall I do? So you try, you buy some moisturizers, and then the moisturizers cannot penetrate through the skin. Why? Because the skin is congested. So you're putting moisturizers on dry, congested skin. Of course, that cannot moisturize your skin. Your skin is anyhow breaking out, not from the moisturizer, but breaking out because it is choked off. It's choked. There is no air, there's no oxygen, it cannot come out. And voila, we are at square one. So boys, girls, ladies and gentlemen, let me explain you that products that you buy commercially are really not suitable to use on a long-term basis. What I personally would suggest is that the best thing would be that you look for a place that can do acne facials. Why I say this? Because if you go to a place and they do acne facials, so they would first of all get rid of all the dry skin. They would abrade it, peel it, remove it. Then they would steam your face and they would do extractions. They would extract everything that's under the skin. Then they would allow the skin to breathe, and they would allow the skin to bring to the surface more of the sebum that's stuck under the skin, which is very important, because you want, as the body extracts it, as the body flushes it and pushes it to the surface, you want it to come to the surface. However, you have to be able to treat it correctly on the surface of the skin so that you don't have clogged skin. So what would be the right regimen to do? So for instance, I can only speak for myself. I can speak for all the patients that I have, all the clients, all the teenagers that come here. So what would I do? So a part of preparing the face and doing microdermabrasion, acne facial treatment, and cleaning and preparing the skin, every person that comes to my clinic will leave from here with a treatment line for oily acne skin. And what does the treatment line consist of? It has a microdermabrasion scrub in there. It has a cleanser. It has a toner. It has a moisturizer, and it has a pimple lotion. How it differs from products that are out on the market is that none of my products have benzoyl peroxide in them. So first of all, they will not dry your skin. Secondly, I use 90% all natural ingredients, and I use a lot of aromatherapy. So for instance, my products, my microdermabrasion scrub, my cleanser, my toner will have in them tea tree, lavender, chamomile, perhaps vitamin C. And these products will not dry your skin out because it's all about balance. So you use the microdermabrasion to scrub your face. So you open the pores, you remove the dead cells, you remove the dry skin. Then you have a cleanser, a foaming gentle cleanser for oily problem skin. You wash the face with it. Then you have a toner. You take a piece of the toner on a piece of cotton and wipe your face with it. So what you did is the cleanser washed everything off. The toner then balances the pH, which means it relaxes the skin. The skin is not up, the skin is not down. So the skin is not oily or dry. And when skin is in a resting stage, neutral, then you put a moisturizer on your skin for oily skin. So it's a moisturizer that's suitable for oily skin. So what we accomplished is that we allow the skin to still bring to the surface whatever is underneath. We unclog the skin, but we keep it clean and we keep it moist and we don't dry it out, because you don't want to dry the skin excessively, because then you're defeating the purpose. And then when you have, let's say, pimples that you want to dry out, then we have this drying lotion that I make, and you use the drying lotion, let's say in the evening you use twice a week only, the microdermabrasion scrub. Usually in the shower you scrub, you remove the top layers of the skin, the dry scaly skin. Then you rinse it off. Then you take the cleanser, you wash your face every night with the cleanser. Then you take the toner, you wipe your face with a toner on a piece of cotton, and then you take the drying lotion, which is for pimples, and you put it only on the pimples, wherever the pimples are, and you let it dry. And then in the morning, and you relax. So your skin is relaxed, your skin is not oily, your skin is not dry. It doesn't have to overwork to bring more oil to the surface, because it's neutral, it's not oily, it's not dry. You prepare your skin for a healing process. Your skin is now starting to heal. And do understand that it has to sometimes get worse before it gets better. So sometimes I get young people with acne breakouts. I say, listen, your skin will get worse before it gets better. Why? Because you came to me in a horrible condition. So now I unclogged your skin, I cleaned your skin, I removed everything, I exfoliated everything. Well, now your skin suddenly can breathe, but there is so much more under the skin that's waiting to come out, that the moment that you allow it to breathe, allow it to come out, it will come to the surface. And so sometimes it gets worse before it gets better. And that's okay, because we want as much of the yucky stuff that's under your skin when you break out with acne to come out. So if you use a balanced approach, which means the principle is basically this: you have to have your skin clean, you have to have your skin moisturized. However, you have to keep your skin always unclogged and always in a neutral stage. That means not up, not down. Because remember, if your skin is dry and you dry it, let's say with benzoyl peroxide or any products that you use, and you over dry it, what physically happens is it's clogged and it's dry on the surface. Well, guess what? Your cells sense that it's dry. There are messages going from your skin to the brain saying dry skin, dry skin, dry skin. So then the brain sends messages back to the oil glands: produce oil, moisturize the skin, produce oil, moisturize the skin. So what happens now? So the brain sends messages to the oil glands produce oil. They push the oil to the surface of the skin. But it has nowhere to go. It can't come out. It can't moisturize the skin because it's dry, it's flaky, it's dehydrated, it's congested, because all the drying stuff that you put, all the chemicals that you put on your skin to dry your pimples. So it's a vicious cycle, right? Can you see it now? So this is why I say that it's acne is a disease, it's a condition. It can be controlled. If it's not severe, then just going regularly for acne facials and then doing this appropriate maintenance that just I described to you, that's the appropriate way to do. However, if you have acne vulgaris, if you have cystic acne, very bad acne, which most of the time happens as a hereditary condition, then you need to see a physician, you need to do blood work, then most likely you will go on Accutane if it's severe. But severe cases are when it's the face, that's the back, that's chest, it's very, very bad, and Accutane is the way to go. And if it's in between, then antibiotics. Sometimes you need to take 3 months, 6 months antibiotics until you clear your skin up. So boys, girls, ladies and gentlemen, I hope that I clarified a little bit and I helped all of you out there. If you have more questions, email me. Until next time, ciao, adios, Eva.